everyone, it's me again. I'm Lena and I'm from the Healthcare Landscape Group. In this video, I'll be talking about my review of the 12 weeks plan. Now, in the past 12 weeks, we've talked about the 12 weeks plan. We have executed the 12 weeks plan, and in this video, this is the 12th week actually, and we're covering the topic for the 12th week, which is making a review of all the things that we have learned in the past 12 weeks. So this is the video that is going to cover about the 11 topics that we have covered. Now, firstly, for the week 1, we have talked about how to access your patient condition as a pediatrician. So my dream job is a pediatrician, if you don't know yet. My dream job is a pediatrician, so of course I'm going to make a video on how to access patient condition as a pediatrician and Kennedy as an orthodontist. But for me, the most interesting thing that I think I've covered in the video is how to make the child comfortable as a pediatrician, and also how to carry out physical exams to assess their patient condition. So those are the things that I find the most interesting in my topic 1. For the week 2 is treatment plan, using numerical data to monitor vital signs, read lab results, and visualize the body structure. So basically, this is how numerical data is used in patient care. And for this topic, I actually think that the topic on the components of the treatment plan and also visualizing the body, that component of the video, is the most interesting to me, that appeals to me the most. For example, how do we use numerical data to visualize the body structure and the advanced technology? I think that is really cool, and I think that the technology is very advanced nowadays. For week 3 and week 4, this is a combined topic. For week 3 and week 4, we talked about mathematical patterns and models in patient care. So for week 3, we covered on mathematical patterns, and for week 4, we covered about models in patient care. So mathematical patterns, we talked about the math patterns, of course, that are present in healthcare. And the things that I find the most intriguing for me is the tools used to assist the pediatrics in their job of diagnosing the patient, reading lab results, etc. Next, the next intriguing thing that I find in the video is about how numerical data, mathematical patterns can help with health management, so healthcare management system. And it actually helps to record things like the number of patients going into a department, and then help with the number of bed traffic. So it's like bed for the bed that the patient is in. There is a lack of beds for the patient in the ICU and for different rooms as well. So we need to decrease that amount by using numerical data and mathematical patterns. For the 4th week, we actually covered on the topic of model in patient care, which I find that the different models and also the Roper, Logan, and Tierney model is the most interesting thing that I covered on. The Roper, Logan, and Tierney model is a model in patient care that is developed by 3 doctors, and I think that is the most interesting thing in the video. The evidence-based models, of course, we talked about the models in patient care in the last week, on week 3 and week 4. Of course, we need to cover on evidence-based models, or EBP. So EBP models in patient care, I learned on the differences between EBP and EBM, the 5 A's, the 5 main steps in evidence-based models, and I learned about what are EBP. What exactly is evidence-based model? For the 6th week, I covered on the topic of IV fluid and medication drip rates for children, because of course my job is, as a pediatrician, I need to work with patients that are kids, so they are children and not yet adults. So in that video, I covered on the topic of the 4-2-1 rule, how to calculate IV fluid and medication drip rates for children based on that 4-2-1 rule, and finally the advantages and drawbacks of IV. Although IV is primarily good, they bring some certain advantages to the patients, but too much of it is not good for the patient, and also if that patient has allergies or something, we need to assess that before giving the IV to the patient. The 7th week, we covered the key aspects of volume in solutions in patient care combined with the examples that we have. So in that particular video, I talked on 5 key main aspects, for example, resuscitation, maintenance, replacement, rate position, etc. So those are the things that we talked about. And then in the essay, I covered on the topic of crystalloid versus colloid solutions, what are the differences and similarities between them. Although they are IV fluids, they have some certain differences between them. For the 8th week, I didn't really cover the 8th week because I was on a family trip on TED holidays, so that week I didn't cover, but the 5 R's of fluid management, I did see Kennedy's version of the work for that week, and the 5 R's is really intriguing, but I won't cover that because it's not my video and it's not my work. Moving on to week 9, data recording in patient care, I discussed on the CARAT framework, the CARAT framework, EHR versus EMR. Although they are both systems to transfer and share patient records, EHR has a significant advantage over EMR. It has more it is more widely used than EMR because EMR has limited abilities. I also covered remote monitoring data and patient-generated data, which I think is the most interesting because the fact that patients can actually generate data through those devices is intriguing, and that shows how technology is really advanced nowadays. And I also learned about what should be in a medical record. For the 10th week, diagnosing techniques in patient care, it is actually the TCM framework. The TCM is traditional Chinese medicine. So TCM, we talked about the 5 main diagnostic techniques that traditional Chinese medicine doctors used long before there are any advanced technology. So for example, they use 5 main diagnostic techniques, which is inquiry, inspection, palpation, listening, and smelling. And also in that video, I made a fun fact on how they used diagnostic techniques and how they diagnose the patient based on the tongue. So the color of the tongue, the what spots are swelling, they can pinpoint to that exact location and in our internal organs. So for example, if our tongue is red or if our tongue is swelling in a certain location, they can pinpoint that to the kidney or the liver, things like that. Finally, for week 11, or last week, we covered on this topic, which is recognizing patterns in patient care as a pediatrician. And this is actually, we talked about the PAT. I talked about the PAT, which is the pediatric assessment triangle, which covers on the work of breathing, the appearance of the patient, and circulation to the skin. And how do they assess that patient without physical contact? The first minute, the first 30 seconds that the patient goes into the room, I look at them and see what is wrong with them or not. The patterns to look for, I also learned on the patterns to look for in patient care as a pediatrician. For example, the vital signs, my intuition, and other things as well. And there's a fun fact that I think that is the most interesting in the video, which is that clinicians can diagnose the patients based on the appearance of the rashes, the location, the pattern of the location, and also the spread. So the pattern of the spread long ago, so before there were any advanced technology, before they even know what pathogens are. So that is all for the 11th week or in this case, the 12 weeks, including this week and this video, about what we learned in the past 12 weeks. I hope that you review all the things that we've learned in the past 12 weeks, and I hope that to see you soon. Goodbye!